Stop scrolling right now. You know cancer is deadly, but what if I told you that the 20 most crucial warning signs are often missed, ignored, or mistaken for simple fatigue, common aches, and the natural process of aging? It is a mistake that costs lives. We're not talking about obscure, rare symptoms. We're talking about 20 simple, critical signals your body sends you that could change everything. We're empowering you with knowledge. Sticking around for the next few minutes could literally save your life, or the life of someone you love. So please grab a pen and pay close attention. Welcome back to the channel. I'm Life and Health, and today we are going deep into the essential early warning system of your body. We've compiled the 20 most critical signs across various cancer-type signs that, when caught early, increase survival rates dramatically. We're going to go through them one by one, explaining why they happen and what you should immediately do next. Quick disclaimer: this video is for educational purposes only and is not medical advice. If you recognize any of these symptoms in yourself or a loved one, please see a doctor immediately. Now let's dive into sign number 20. Sign number 20, persistent cough or hoarseness. This is often the easiest symptom to dismiss, usually mistaken as a long-lasting cold, allergies, or even dry air. But if a cough lingers for 3 weeks or more, especially if you smoke or have had significant exposure to pollutants, it needs immediate investigation, as it could signal lung or throat cancer. Sign number 19, unexplained weight loss. If you're not dieting, you haven't changed your exercise routine, yet you suddenly drop 10 pounds or more in a month, that sudden loss of appetite and unexplained weight drop is a serious red flag. It means your body is fighting a grave underlying issue, possibly pancreatic or stomach cancer, which is consuming energy stores. Sign number 18, changes in bowel habits. Look out for changes that last longer than a few days, such as persistent diarrhea, new-onset constipation, or feeling like your bowel isn't fully emptying. These changes are key indicators for bowel or colorectal cancer and should never be dismissed as just bad digestion. Sign number 17, difficulty swallowing, dysphagia. If eating solid food or even drinking liquids becomes painful or feels like food is getting stuck, this symptom, known as dysphagia, needs urgent attention. It could point to cancers of the esophagus or throat. Sign number 16, unusual bleeding or discharge. This can manifest as blood in the urine, stool, or unusual discharge from the nipple or vagina outside of a menstrual cycle. While often benign, this is a prime indicator for cancers of the bladder, kidney, cervix, or breast. Sign number 15, persistent heartburn or indigestion. Everyone gets heartburn, but if over-the-counter medicine isn't helping, and you have constant acid reflux, this chronic irritation can sometimes be a sign of stomach or esophageal cancer. Sign number 14, changes in a mole. Always check your skin using the ABCDE rules: asymmetry, border irregularity, color variation, diameter, over 6 meters, and evolving, any change in size or shape. Any changes to moles or sudden new dark spots are critical signs of melanoma, the deadliest form of skin cancer. Sign number 13, unexplained night sweats or fever. If you have recurring high temperatures or soaking night sweats that aren't linked to a cold or the flu, this is a common, non-specific symptom that can indicate lymphomas or leukemia. Sign number 12, persistent abdominal pain or bloating. While women often attribute bloating to monthly cycles or diet, if pain and bloating become persistent, meaning they last for several weeks, it can be a subtle but key symptom of ovarian or pancreatic cancer. Sign number 11, skin changes. Look for yellowing of the skin or eyes, jaundice, darkening of the skin, or new redness or itching that lasts a long time. These can all be external symptoms reflecting internal issues, such as liver function problems or underlying cancers. Sign number 10, unexplained aches or bone pain. If you have constant worsening pain in your back, hips, or other bones that isn't linked to an injury or arthritis, it could indicate cancer that has spread to the bones, or in rare cases, bone cancer itself. Sign number 9, mouth changes. If you notice persistent white patches in your mouth or on your tongue that won't go away, or sores that fail to heal, especially if you use tobacco, these are common precursors or signs of oral cancer. Sign number 8, chronic worsening headaches. A headache that is new, unusual, and keeps getting worse, particularly if it's accompanied by nausea or vomiting, can occasionally be a warning sign of a brain tumor. Sign number 7, sudden vision or hearing changes. Any rapid, unexplained decline in sight or hearing should be investigated immediately, as it could signal a tumor near those nerve centers. Sign number 6, constant pelvic or back pain. For women, chronic pelvic pain that isn't menstrual or chronic lower back pain can often be subtle indicators of ovarian, uterine, or colorectal cancers. Sign number 5, persistent swollen lymph nodes. Your lymph nodes, often felt in the neck, armpit, or groin, are your body's immune checkpoints. If they remain swollen for weeks without an obvious infection, they need immediate testing, as this is a common sign of lymphoma. Sign number 4, unexplained bruising or easy bleeding. If you suddenly bruise very easily, or if minor cuts bleed for an unusually long time, this can signal issues with blood cell production, which is a symptom seen in leukemias. We've covered many critical symptoms, but that brings us to the top 3 most commonly missed and most deadly signs. You need to pay attention here. Sign number 3, blood in your stool or urine. You must never, ever assume this is just hemorrhoids, a minor cut, or a bladder infection. This is a critical, high-alert red flag for bowel, kidney, or bladder cancer. Get it checked. Sign number 2, a lump, swelling, or thickening anywhere on the body. Whether you find it in the breast, testicle, under the arm, or in the neck, any new, unexplained mass needs immediate medical review. The size doesn't matter. The newness does. And the number 1 most deadly and ignored cancer sign is